Cure Violence is a global initiative that works towards stopping the spread of violence. This is also a presentation by Sarah, Geoff, and Simone. So, Cure Violence was founded by Dr. Gary Sulkin, former head of the World Health Organization's Intervention Development Unit and the professor of epidemiology and international health at the University of Illinois, Chicago School of Public Health. Cure Violence launched its first initiative in Chicago's West Garfield Park neighborhood. Cure Violence works in more than 100 communities in 25 U.S. cities and 15 countries, with a focus abroad in Latin America and the Middle East. There have been several heavily impacted communities since its start. The impact has pretty much been vast. I mean, we're talking over 100 shootings in a single weekend to 0 shootings in a single week. In reviewing the issue of community violence, it is important to understand that all types of violence are contagious and related. Violence in the communities, schools, homes, prisons, and even the battlefield is contagious between settings and types. For example, someone exposed to community violence is more likely to be violent at home, in school, and a person exposed to war violence is more likely to be violent in his or her home and or community. Violence can be interrupted and stopped using health approaches, and this is actually the approach of Cure Violence. There is a need to mobilize the healthcare and public health system and methods to work with the communities and other sectors to stop this epidemic. Again, Cure Violence hopes to continue to lead this effort. Cure Violence approaches violence with the understanding that violence is an epidemic process, and it's not going to solve itself overnight, though it can be stopped using the same health strategies employed to fight epidemics. This theory of change utilizes carefully selected and trained workers, trusted members of the communities we serve, to anticipate where violence may occur and intervene before it erupts. Identify those at risk for violence and work to change those behaviors and influence social norms to discourage the use of violence. In addition to high-risk individuals, Cure Violence's success also depends on expanding their audience to focus heavily on partnering with like-minded individuals and organizations, all focused on the common mission of reducing violence within inner-city communities. They wish to do this through using the health approach and conveying the message that the residents, groups, and the community do not support the use of violence whatsoever. The work is grounded in the communities most affected by violence and led by community partners who incorporated this approach into efforts to build a healthy community, healthy relations. For Cure Violence, the educators are vital in the overall effort to cure violence. Trained violence interrupters and outreach workers prevent shootings by identifying and mediating potential lethal conflicts in the community, and then following up to ensure that the conflict does not reignite itself. The violence interrupters work to prevent retaliations, mediate ongoing conflicts, and keep the neighborhood copacetic. Trained culturally appropriate outreach workers work with the highest risks to make them less likely to commit violence by meeting them where they are, talking to them about the cost of using violence, and helping them to obtain the social services they need, such as job training, psychological services, and drug treatment. Outreach workers access the highest risk individuals to work towards solutions, convince high risk individuals to change behaviors, and provide treatment when necessary. As mentioned in the previous audience slides, community leaders and partnering are key to the success of the program and play a significant role in the educating of high risk individuals. In addition to the traditional tactics and channels, it is worth noting that a big part of Cure Violence methodology is data-driven. The data gathered helps the organization focus on the right neighborhoods, the right individuals, and the right situations and solutions to get the maximum results. It is admirable how deep the community is rooted in the organization's efforts and how intricately involved the organization is within the community's lives. Cure Violence is trusted, which makes it easier for community members to cooperate in the process and approach into the efforts to build a healthy community. It is honestly not a surprise that this organization is successful and is very visible in the overall violence movement. The results from the community outreach speak for themselves, but the content truly elevates Cure Violence as a national and international thought leader. The outcomes that Cure Violence has achieved have been significant, extremely helpful. While the reduction in violence in Chicago has been successful, there is also considerable success in other cities and countries such as New York, Philadelphia, and Trinidad and Tobago. In addition to the improvements in violence statistics, there are also a significant financial return on the investment due to Cure Violence intervention in Chicago. In 2014, there was an estimated $77 million savings resulting from the use of Cure Violence health models. That's more than 10% of the government's savings, people. Cure Violence is not only curing lives, but they're saving money. It will be interesting to watch how Cure Violence continues to impact the global community and work towards solving the spread of violence. Thank you so much for listening to this presentation. I've enjoyed presenting to you. Bye-bye.